Hello everybody, welcome back. Another episode of I don't know what to call this. America. I think the last video was America Woke Up, and I think I'll call this video America America let me think. America Hyped, I guess. America Hyped. You understand why I think I picked that name, America Hyped, because of hypertension, or high blood pressure. Another word for saying high blood pressure, I guess. Anyways, I'll talk a little bit about my day here. It was pretty mundane. I found out that I got, well, the wave of infection is coming down towards the south of America, the south, and looks like I'm at 14 days. Let me just take a quick look at the yeah, right here. Yeah, 14 days. I can refresh this. I didn't refresh everything, so around 7 o'clock I got to the website, refreshed all the websites. That way they're all relatively the same number. You know, I just want to compare them. Okay, so 14 days till peak. This was updated April 8th Pacific time, last updated. So it looks like they're updating on a routinely now. So 14 days. Enough hospital beds, enough ICU beds. 14 days till peak. What is today? Today is, right now, this recording is 9 p.m., 9:23 p.m., April 8th, 2020. So let me get to the April 8th, 2020 here, because that's when I'm recording this. So April 8th, April 22nd is the peak, which is in 14 days. So we're probably, this is for Texas, and I'm in Houston, and pretty much 14 days prior is probably when it's going to be the most infectious, or the most amount of people are being infected, because the incubation period for the coronavirus is about 14 days. So I probably don't want to go outside at all. I don't want to interact with anybody, and I'm not. I haven't been outside for, well, I think Monday we went to I sent my wife to the grocery store, so did some more pandemic shopping at the local HEB. In the morning, it was Monday. Today is what, Wednesday? Yeah, today's Wednesday, April 4th. So Monday, I woke up to get the lunch food, or breakfast, and breakfast at the school for the kids. My wife went to HEB. They open at 7 now instead of 8 o'clock. So Monday, I told her to go on Monday, go first thing in the morning, because that's when they restock the shelves and sanitize the store. And so this time she was able to get powdered milk, which I make hot chocolate with. Hot chocolate, a little bit of cocoa powder, or powdered milk, cocoa powder, hot water, Hershey syrup, vanilla extract, just a little drop of vanilla extract, and whipped cream on top. So, and the powdered milk is a backup for milk, because the kids go through milk really fast. So we got 1, 2, 4 of the 1 gallon buckets of milk, and we had to buy more because they already went over the weekend. I don't get any free meals for the kids, so we eat the most food on the weekends. And I'm also rationing the food as well. I'm rationing the food. I'm eating only 2 meals a day, so we either have a nice heavy brunch or a early lunch and then dinner. And we're kind of rationing because I don't want to go out for the next 14 days, and according to this, April 22nd is the peak. This changed on me from yesterday. I was originally going to try to get out on the 25th, but it seems like the 25th may not be ideal. I may have to wait it out to May 1st, or even May 5th. Maybe have to wait it out on May 5th. The good news is that this peak here is a very low peak. It's a hump. It's not even a peak. It's a hump. If you compare it, supposedly total death of 2,000 all the way up to August 4th. So I'm at April 8th right here. Total deaths 192. Let me check something out real quick. What was today's difference in 11 deaths? So I don't know. I think this is this projection is a little, it's off. It's got to be off, because unless they're expecting the South to really ramp up here in the infection, I don't know. I don't know. This is going to be interesting. So I'm literally at the calm before the storm here. So I'm not going to go out. I'm going to try to ration my food as long as I can. This one says April 22nd. The peak of the death will be 66 per day. So right now we're right here. We only had like literally 11. They're expecting 32. I don't know. I'm hoping this is overblown. Although these numbers aren't high, but still, one death is too many for me, in my opinion. One death is too many for me. So that's kind of what I've been doing. Just reassessing our food. I still will go out to get the lunch and the breakfast from the school for the kids. That tremendously helps in our food supply. We barely dipped into our food supply here, or we're only making dinner for the most part. We're eating the leftovers from whatever the kids don't eat. Even though the school lunch is horrible, we're eating it. We're eating it. So they have some good stuff, some sweet stuff. That always goes pretty quick. The bland vegetables and whatever else they have, school lunch, school breakfast, hard to swallow sometimes, but we eat them because I know I need to save the calories. Another thing I've been doing is we've been communicating. We're all in separate rooms right now, just in case one of us does get infected. I get infected from going out, or I don't plan on going out, but for whatever reason we are infected. Everyone's in their own separate rooms right now, and my wife's in her bedroom because she's working at home. I'm mainly in the living room, you guessed it, on the couch. That's exactly where I belong, on the couch. So that's where I am, and the kids are upstairs most of the time unless we come down to eat. We don't try to congregate together too much. As soon as we're done whatever we're doing, we just go back into our rooms, and the kids like it. That works for them. But we mostly communicate with our BaoFeng ham radios that I use mostly as a walkie-talkie, and an FM radio and some other radio that comes out on the on a certain frequency. So that's how we mainly communicate, so we don't have to interact as much, and that's kind of what we've been doing. So it's overly precautious, but I think it's worth doing just in case one of us happens to get infected. Don't want the whole family to get infected. So all right, so let's enough about me. Let's get into the numbers. We'll get into numbers. I'll go over New Jersey and New York numbers. I'll actually go into like the state websites, and we'll take a look, because they're in the eye of the storm right now as we speak, literally. So New York and New Jersey are basically, well, New York's definitely in the eye of the storm. New Jersey got moved back a little bit, but let's take a look at their numbers and see what their state website looks like. It's pretty interactive. I'm kind of impressed. Everyone's website is getting more advanced and more information. I think that helps because as the wave or the surge potentially starts hitting your area, wherever you are, you want to start hunkering down. You want to start staying at home and have very little interaction with other people. So let's get into numbers here. Wow, that is a very high number. Look at that. Look how high that number is. Jeez. It's almost 500,000, almost 500,000 people infected here. Very close to hitting that peak number again. 32,000. Oh, let me total case 429,052 total cases, with a new case today of 32,829, just barely below the 33. So it looks like you're going to get some peaks and hopefully some valleys here. It'll be a pretty rocky. That's a lot. You're getting a lot of new cases every day for this week and next week. Probably for the next 2 weeks here, you're going to get a lot of cases. The wave is starting to move. The wave is moving from the East Coast and into Middle America. I don't know if the West Coast is moving in. There's a lot of space, a lot of Rocky Mountain, empty space, deserts between those areas, but definitely the East Coast is the wave is moving into Middle America, so we got to be very careful. Total deaths here, 14,695 total deaths. It's still a lot. It's still a lot. Total deaths today, 1,973. It is an increase. It is an increase. So if you look on this normal chart, looks like nothing's happening. But let's take a look at the logarithmic chart, and you'll see that there seems to be a bending of the curve right here. And if everyone uses social distancing, hopefully that curve can start bending downwards, and we'll let the coronavirus pass over. All right, let the coronavirus pass over. Okay, so like I was saying, if you ever look on a map, you'll see a lot of roadways if you split it down right here in the middle, from here to the east, there's a lot of cities, a lot of roads interconnecting here. Obviously, New York has been the epicenter, has been the major epicenter, spreading to New Jersey. It's going, the surrounding states are getting it, and you can see it's spreading out. And then parts of Florida was hit as well. It's spreading out here through the south, spreading out here through the north. It's basically going from east to west. It'll probably stop right here because, if you ever look at a map, you'll see all the roadways, and it kind of just dwindles out right about here, right through Middle America, through Texas, Oklahoma, Kansas, Nebraska, South Dakota, and North Dakota. Then out here, it's just Rocky Mountains and deserts and plains. Not a lot of roads. Well, obviously there's roads, but the population density is far less in this area, and then you get to the West Coast. So the West Coast is doing a great job of holding its own. It's, for whatever reason, it could be geographic as well, but Seattle, parts of Portland, San Francisco, Los Angeles, San Diego is getting the worst of it. It's slowly making its way towards middle, but not as fast compared to the East Coast here. The wave is starting to come through, and so it looks like in some ways it's jumped all the way out here to Louisiana, Florida, Georgia, and so it'll probably start spreading out. It's burning through out here in the south, and the north, it's burning up here through the north. It's eventually burning its way through here, and it's probably gonna it might have a slight backstop right here in the Middle America. That's what I'm thinking. So next 2 weeks, next 14 days, I am really hunkering down because I don't want to be caught up in the coronavirus flame. Wow, 11,000, a lot today, a lot. It's jumped up again. I hope that that is just the way it works. It goes down, stays down, jumps up, goes down, jumps up a while, and then hopefully it'll burn through whatever it's burned through, and the stay-at-home quarantine is working, and it looks like it is working. But again, we'll have to have time. Time is going to be going to tell the truth. So 32,000, almost 33,000 right here. So in between here and here, it was going down, kind of going back up, hit almost to the new high again. It may hit a new high. It may just hit the high, just touch up on that, and then hopefully it'll level off and go down. I hope. At least this is what the numbers are telling me. And it looks like it is a little stall right here between April 4th to April 8th. It's been stalled. I hope it stays stalled and goes down. I hope. We won't know. New York is definitely trending downwards. Seems like it's trending downwards. We'll see what happens to the rest of the states. I think the south is going to be burning through, and a little bit of the north is going to be burning through. It's going to meet its way right in the middle. Okay. Anyways, I'm focused on America right now. I don't have time to look at some other countries. So I did not update this. I'm not going to update it. I just want to see what it was yesterday. So it looks like it says 10,000. So it's been ticking up in New York. And now, well, it says 8,000. Let me see. What did it say here, though? It said here 11,000. Well, that doesn't look good. I refreshed this right at the same time as I refreshed this. So I was hoping to get kind of like same information, but who knows. I don't want to refresh it because it'll most likely will wipe it out. But supposedly it was doing good, but maybe not. I'm crossing my fingers. I'll say a prayer. I'm not going to say it right now. I'll do it in my own time. But I'm going to cross my fingers. New Jersey is definitely ramping up. It's got another, I don't know, I think another week or two to work its way through. Michigan is starting to feel the burn. Michigan is going to start to feel the burn. Louisiana is supposed to feel the burn, but I don't know. There's something not quite right about Louisiana. It just doesn't feel, something's not right. The total number of tests and total number of cases confirmed, I don't know. Anyways, I'm down here, and I hope I hope Texas stays down here. Although it's doing a lot of testing, it's staying barely under 10%, around 9%, above 9%, below 10%, which is good. Hopefully it can go down. Supposedly it's going to get a surge here in the next 14 days. I'll watch it. I'll be watching it. So yesterday and today, a slight increase in confirmed cases. Looks like everybody had a little slight increase in confirmed cases today. All right, so let me refresh this. This has changed, though. This has changed. So you're getting a little bit more dynamic information here, which I like a lot. So let's check it out. Let me refresh it here. 96,000 tests, 9,353 total confirmed, and looks like 177 fatalities. Estimated patient recovered. So they got estimated patient recovered current in Texas hospitals. So they got about 1,491 in Texas hospitals. I don't know if that means ICU or just in beds or whatever, but I guess that's how many people they got in the hospital. So gives you some idea. Like they do the test, and this is how many gets confirmed. So it's about 10%. And out of this, about 1.2 or 1.5, maybe 1.5% goes into the hospital. And it looks like out of the people that are in the hospital, you either get recovered, okay, and I don't know what that, there's a big gap. I don't know what it means, because look at how many people are reported and how many people recovered. This is not adding up, right? Even if you add the death, people in the hospital, patients recovered, it doesn't add up to 9,000. So I don't know what happened to the other people. Maybe they're just mild symptoms, and the people that were in the hospital recovered. Out of those people that went to the hospital, 770 have recovered out of the hospital. You either end up dead or alive. I guess that's the only way I can say. You go into the hospital and you come out dead or alive. So anyways, so like about one and 1.2% out of this number ends up being a fatality. You end up dead. I guess that's good. I mean, it's being whittled away until you end up with a very small number of deaths. I'd rather have that than being a very large number of deaths. So they got that. They got fatalities by county. They already had that. You've already seen some of these numbers. The graph is obviously a little different. Most people infected 40 to 49, but the group 20 to 59 years of age, probably the most infected. Makes sense. It's probably the most people in the population. Hospitalizations, there you go. So a lot of hospital beds, a lot of hospital beds, a lot of hospital beds. So I'm not worried. I think if you do get infected out here in Texas, you'll survive or you'll be treated. You'll probably be treated. You see regional hospitals. I'm in section Q, and section Q looks really good here. Let me scroll down to section Q here. It's going to tell me the hospitals. There it is. So population, estimated population of 2.3 million. Total hospital beds about 1%. 2,123 hospital beds, available hospital beds. Only 1,107 available hospital beds, 166 ICU beds, 242 ventilators. Well, hopefully we won't need that many. Hopefully. So that gives you some hospital information, which I like. All right, so let's go to these numbers here. So this is the number here, 31,000. Again, I refreshed it around 7 o'clock, and then I kept it that way because this one just keeps adding on to it. I don't know when it restarts, but you can see the death rate is going up. It's been going up since I've been doing this every day. Been going up. All right, let's see what this one says. And again, I refreshed it at the same time. I refreshed, got this information, which is about, I think it was at 7:51. This was updated 7 o'clock. So this is 7:51, only 51-minute difference, but I think it's pretty safe to say New York, it's gone up. Death rate has gone up. New Jersey's death rate has gone up. Michigan's death rate has gone up. Louisiana has gone up. You can see these new cases, new death. Yeah, it looks like New York, New Jersey, and Michigan had its spike today, unfortunately. So let's go on to New York's website. So this is, oh, it's refreshing. Okay. So it's refreshing here, and you can see very, very detailed, a little different. And you can see that here, and if you, this shows the downtown states or downtown counties here. Gives you information. Kings County, Queens, King and Queen County or boroughs here have the most tested positive. Between these two, they have about 50,000 positive cases. So, and then you can see daily trends here. very different. Today was like the most. You could see the test and then the positives. This was the most that they've done. Almost most. This is like the most positive. They did a lot of testing today. They really went all out today. And then table. Let's see what the table is. So here you could get the rates. This is today's rates based on 25,000 tests and new positives. 41%. Just in New York City is a 51%, and then all of New York, excluding New York City, is 32%. So New York City really, really infected still to this day. And it breaks down here. So Bronx, 52%. What's another really high one? Kings County, Nassau is in the 40. Manhattan, 41. Nassau, okay, let me see here. Queens, and then you have Richmond and Rockland. Suffolk. So if you're into this information, if you're into this, there you go. They even have fatality data here real quick. Today's not a good day. Today's just not a good day. They even give you some information here. In New York City, they give you a population percentage of Hispanics, and then also blacks, whites, and there's a lot of coverage, news coverage going on about blacks getting more affected, well, Hispanics as well, and then you look at the whites, so it's 32% of the population, but only 17% of, I guess, reported cases or fatalities. This is actually fatalities, so 27%, 27% are white who have passed away, but they represent 32% of the population. And I don't know if that has to do with health issues. Everyone's getting treated. It's not like people aren't getting treated. And that takes me to let me see here. Oh, they reset the this refreshed. Anyways, hypertension is like the #1 thing that will kill you if you get the virus, which is high blood pressure, which is interesting. Second is diabetes. I don't even know what this is, but if you have high blood pressure and diabetes, man, between those two, you may not have a chance. So I don't know what it is about Hispanics and black, why there are more death. It could be also because they're getting more infected because, again, they probably are the majority of the essential workforce that go in there. I think a lot of white-collar jobs working out of their home. That's just my opinion. If you go to New Jersey, it's same thing. New Jersey website, not much to look at, but you can highlight these. And if you look at these 1, 2, 3, 4, 5, 6 counties, they're all right here along the border of New York City, which I was telling you, that's probably where you're getting a lot of the infection spread. And you can see their numbers just increasing like crazy, exploding. And like I said, they got, let me see here, if I can just quickly go in here. They got a ways to go. Let me see. They have 3 more days till peak. So their whole thing changed as well. This thing changed as well. They're supposed to be in their peak. They got 3 more days of this, so they're not out of the woods yet. They got a long way to go. Anyways, I'm going to end this episode. Please like, comment, share your experience. Are you prepared? Because the wave is now traveling through to Middle America. If you're in those places, shelter in place.